So I went into medicine really because that's what I saw growing up. I saw both of my parents who were both physicians, and I grew up in a small town in mid-Michigan where everyone kind of knew each other. So whenever I would be out with my dad, at the grocery store or even just walking down the street, a lot of times we would see patients or see people who would kind of call out and be like, "Hey, Dr. Shvali," and they would talk about their kids or their lives or whatever was going on. And that kind of community feeling, that relationship building that I saw between my parents and the community that we grew up in really drew me to medicine. It was really what I wanted. My name is Neha Shvali, and I practice general obstetrics and gynecology. I chose OBGYN for a lot of different reasons, but I think the biggest one is that I'm really passionate about women's health and women's healthcare in general. I think it's a field or an aspect of healthcare that tends to get overlooked, both societally and by women themselves. I think they tend to get pulled in a lot of different directions, both in the workplace and at home. And I think sometimes their own health or their own healthcare is something that can fall to the wayside until a big life event, something like a pregnancy, comes up, kind of forcing them to relook at their health and focus on it. So I appreciate being able to advocate for women to focus on their health, both on an individual and on a societal level. Another big thing that kind of drew me to it during my training was that it's one of the few fields where you get kind of the whole breadth of continuity of care, where you get to develop relationships with patients, see them in the office, see them through a lot of different life transitions and events, from adolescence to early adulthood to, of course, pregnancy care, which is a big part of what I do, and then also the perimenopause transition, the menopause transition, so that kind of ability to form relationships with patients, see them through a lot of big pivotal moments in their lives is something I really enjoyed in training and continue to enjoy in my practice. I offer kind of the whole breadth of general OBGYN care, from sexual health to birth control, counseling, to reproductive health options, procedures like IUD insertions, like colposcopies, depending on what people need. And then pregnancy care. Pregnancy care is something that I really enjoy, that we provide a lot of. Another thing that I provide is menopause care, being able to counsel patients through the perimenopause transition and into menopause and kind of ease that transition with hormone therapy or discuss other options that can make that a smoother transition. I think my most important role is to educate patients and to teach them about their health or their condition, if we're talking about a medical condition, and help them to understand that so that they're able to make the best decisions for themselves that are in line with their goals for their health. So I think the most important thing to remember for any new patient coming to see me or any of my colleagues in the office is really all it is to start with is just a conversation. All we're doing is getting to know you, getting to know your history and your health, and then anything that we do from there is really up to you as the patient. What exams we do, what things we talk about, all guided by you. A lot of patients who get their care within the Johns Hopkins system, because it is such a fantastic health system, really like to keep their care within the system. And so now having offices where patients can continue to have their OBGYN care in Northern Virginia and DC, I think is a great benefit, especially in times of people's lives when they need to be seen more frequently, such as during pregnancy, where visits can be weekly or even more often. Having an option that's not too far from where they live, I think, has been really great for a lot of patients.